So you're launching med spa or maybe a new clinical practice. You've probably got your services, your brand, your whole team mapped out. But then you hit this one question that just stops you dead in your tracks. How in the world do you figure out what to pay your medical director? It's a huge question. Okay, let's dive right in and get you some answers.
This is the big one, isn't it? It's the question we get all the time. You know you need a physician for legal oversight, but they aren't seeing patients, they're not really generating revenue in that traditional way. So, what's the magic number? Well, here's the thing. There isn't one singular magic number, but there is a right way to figure it out. And that's exactly what we're going to break down right here. How to do this so you stay compliant and financially smart.
All right, before we even start talking about dollar signs, we have to talk about the single biggest mistake founders make. I'm talking about a legal minefield you absolutely have to steer clear of. We call it the rent a license trap. And let's be absolutely crystal clear about this. The whole idea that you can just pay a doctor a flat monthly fee to slap their name on your door and use their license while they have zero real involvement, that is illegal. This isn't some gray area. It is a giant red flag for any regulator looking at your business. Now, what do all these scary legal terms actually mean for you? Well, fee splitting means you're illegally sharing medical services profits with a non-doctor. The corporate practice of medicine doctrine, which exists in a lot of states, says a business can't practice medicine. And anti-kickback laws, they stop you from paying for referrals. A passive rental license deal can light up all of these violations like a Christmas tree. So if you can't just pull a number out of a hat, what's your guiding star? It's this term right here, fair market value, or FMV. This is your absolute key to compliance. Basically, it means your physician has to provide real, actual clinical oversight, and their pay has to be based on those real responsibilities, their time, their expertise, their legal risk, and not, I repeat, not on how much money your business is bringing in. Okay, so now we get the why behind doing this the right way. So let's get to the good stuff, the how much. We're going to break down the real-world numbers you need to be thinking about, and it all depends on how involved your director really is. Right at the beginning, when you're just getting the doors open, this is a pretty common range. Now, at this level, the director's duties are fairly minimal. They're reviewing your starting protocols, maybe doing a check-in once a quarter, and, this is key, they're available on call for any urgent clinical questions that pop up. You're really paying a baseline fee for their liability and their availability. Now, this tier, this is where most established, growing practices find themselves. As your business grows and you see more patients, the director's job gets bigger, right? So here, they're much more involved. They're updating protocols, actively supervising your nurses and PAs, and doing regular chart audits to make sure the quality of care is top-notch. More engagement means higher compensation. Simple as that. Okay, now we're at the top tier. If your medical director is in the building, hands-on, pretty much every day, their pay has to reflect that deep commitment. This is for the physicians who are doing patient consults themselves, performing procedures, or giving daily supervision over more complex stuff like IV therapy or advanced injectables. Their time commitment and their legal risk are at an all-time high, and the paycheck has to match. And this right here, this little clause, is a game changer. It's a crucial strategy for any founder. Look, your business is going to grow, your needs are going to change, so your agreement needs to be able to change too. Building in a review clause like this is, frankly, non-negotiable. It lets you start small at that lower startup rate, but with a clear plan to revisit the pay as the job and your practice get bigger and more complex. So we've got the big concept, fair market value, and we've got the numbers. Now let's put it all together. Here are 4 essential rules for structuring an agreement that isn't just fair, it's legally bulletproof. Okay, let's just quickly run through these because they're important. 1. Use a flat monthly fee, period. This is the safest way to go because it cuts the link between their pay and your revenue, and that keeps you out of that fee-splitting trouble. 2. Write everything down. Define exactly what supervision means. Is it chart reviews, protocol approvals, handling emergencies? This protects you and them. 3. The pay has to match the risk. Seriously, paying a director $500 a month to oversee really risky procedures just doesn't pass the sniff test with regulators. And 4, don't forget malpractice insurance. Your contract has to say in black and white who gets it and who pays for it. When you boil it all down, this is the goal. You're not just looking for a number to plug in. You are building a logical, defensible payment structure that's based on real work and fair market value. It's a structure that protects your business, proves your clinical oversight is legitimate, and is flexible enough to grow right along with you. And that really just leaves us with one last question for you to think about. Take a hard look at your current agreement, or the one you're about to write. Is it just a static, risky arrangement based on some number you hoped was okay? Or is it a dynamic, compliant framework that's actually built to last? Because honestly, the answer to that question could define the entire legal health of your business.